everyone. It's Dr. Erin here, one of the good doctors of Abbey Research, and it is Monday, April 20th. Where the of April has gone, I don't know, especially since March was an actual decade. But I'm here with today's Good Doctors Diagnose, and I wanted to talk a little bit about kind of some of the stories that I'm hearing from my friends and colleagues who are now working remotely during this COVID-19 crisis, and hearing lots of different stories about how people are being managed by their supervisors and leaders very, very differently. And so this GDD goes out to the people at the top of the management and leadership ladder in your organization. And I really want to emphasize that it's very important for you to build a cohesive management strategy for managing remote workers during this time. You might have a lot of teams that you're responsible for, and each one of those teams has a team leader or a manager. And if you aren't communicating with them how your organization wants to lead and manage during this time, especially remotely working, you could get a lot of different perspectives on what leadership and management look like. You get a spectrum from people who are being really empathetic and flexible on deadlines to people who are being taskmasters and really not paying attention to the emotional well-being of their employees. These are exceptional work circumstances if you are privileged enough to still be working during this economic crisis. It doesn't mean it's not hard and that you're not learning possibly an entirely new way to do your job, especially if you were previously on site and now you're working remotely. So it's important to remember that we're all dealing with exceptional circumstances in our public life and in our private life. And that needs to be considered when you're managing and leading your employees. You might want to learn a little bit more about them than you normally do to understand how you can provide support if they're caring for others, if they have children that they're homeschooling, if they have elderly relatives that they're trying to make sure that they provide support for and do their grocery shopping and pick up their prescriptions while we're all living under this new social world of isolation. So make sure that you have a cohesive and agreed upon and a well communicated management plan and strategy. I know we were all scrambling for a couple of weeks to get used to what life looked like in this period of isolation. But as things start to settle down, it's a great time to check in with your team leaders, make sure that you're all on the same page and that everyone in your organization is being treated and managed in the same way. So that's all we have for today's Good Doctors Diagnose. We'll be back on Wednesday with more for you. Be safe and be well. Take care.